Hello, good evening. How are you? Here we go again with our new question session regarding the same field. So, shall we begin?
Yes, sir. Why not? Why not? Yes.
So, the question number one for you is, what is difference between intra-aortic balloon pump device and impeller pump device?
Okay. So let's start with your question, and I will try to answer you. So intra-aortic balloon pump device and impeller pump device, both devices are used in cardiology in a cath lab mostly, even in operating room in a cardiac surgery. The function of intra-aortic balloon pump is to reduce pre and afterload, increase coronary artery perfusion, increase mean pressure, and in augmented and diastole phase we augment the coronaries, and we try to perfuse and reduce the oxygen demand and helping to the heart during the time when the heart is not in a good condition.
All right,
And-
all right.
And I just want to add a few more things. And balloon pump, the most better thing was done by the balloon is to inflate and deflate. This is the main work done by the balloon catheter. But for impeller, of course, impeller is also using in cardiology, and the insertion of impeller is of course through the femoral, mostly commonly in cardiology. We use the impeller small pump through the catheter, which was floated by the cardiologist through the femoral vein, femoral artery in the left ventricle. So the main function of the impeller pump is to reduce the afterload. So we unload the LV vent, and we are assisting to the ventricle through the pump during the high risk PCI or any interventions. And the most common difference is in a balloon, the placement of the catheter is below than subclavian and above than renal artery, the catheter, and the catheter work is to inflate and deflate. But in impeller device, we enhance this catheter, the impeller catheter, which containing a motor small, which was just sucking the volume from the LV and taking out into the ascending aorta to perfuse the body. And normally this is happening in the cardiology. It can work, it can be used in even the operating surgery, for the cardiac surgery also, in a cardiac surgery department. Hope it is clear.
Oh, thank you, thank you. So, can you please briefly tell, like, for the lay language, like, in which cases you recommend to use IABP and in which you use impeller pump?
See, if we're going to, there is two things we need to highlight. Both devices can be used in the cardiology, especially for high risk PCI or the post wean, difficult to film for the bypass. We can use the both devices together. The function of both devices is to help to the severe poor LV heart, to assist them till they recover it up. But mostly the commonly we are using intra-aortic. Both devices are the circulatory sports devices, mechanical circulatory sports devices. Impeller mostly using for the high risk PCI during the procedure. Balloon pump is used most commonly because it's compared to the impeller is very cheaper. Impeller can be the bridge to transplant or bridge to ECMO, but intra-aortic balloon pump has some limited. Its work is with unlimited, like you inflate and deflate, perfuse the coronaries. But with impeller, we suck blood from LV and we help to aorta to deliver blood to the part of the whole body. Hope it's clear.
Oh, thank you, very well explained. And see you again with the next session and questions. Have a good day.
Thank you. God bless you.
Can anyone guess what this medical device is? If you said intra-aortic balloon pump, then you are correct. Intra-aortic balloon pumps are a common tool that cardiologists use to treat cardiogenic shock. In cardiogenic shock, the heart is not able to pump enough oxygen to meet the demands of the body. The two main mechanisms that this helps treat cardiogenic shock is by decreasing myocardial oxygen demand by decreasing afterload and improving coronary blood flow. The balloon inflates during diastole and deflates during systole. When it inflates during diastole, it pushes blood back to the heart and increases coronary blood flow. You can remember this because most of coronary blood flow occurs during diastole. This improves the amount of blood flow that the coronaries get. The second mechanism in which this helps in cardiogenic shock is by decreasing afterload, or the pressure that the heart has to pump against. When it deflates during systole, it causes a suction effect and
the IMPELLER system is placed percutaneously through the femoral artery using a monorail technique and a standard pigtail. It is advanced across the aortic valve and into the left ventricle. IMPELLER pulls blood from the left ventricle and expels it into the aorta, actively unloading the left ventricle. This active unloading of the left ventricle increases end organ perfusion and protects the kidneys from acute injury. IMPELLER is the only percutaneous heart pump providing hemodynamic support to enable heart recovery. IMPELLER is indicated for protected PCI and cardiogenic shock in the setting of AMI and post-cardiotomy. IMPELLER provides hemodynamic stability during angioplasty and stent placement by maintaining mean arterial pressure. By providing